Well, it's winter time, and as we know, that's the time of year now that we're in this COVID pandemic that activity ramps up. So, as usual, I have to go to my pandemic guru, Dr. Ali Mokdad, with the University of Washington's Institute for Health Metrics and Evaluation and UW Medicine. Doctor, thank you for joining me. I appreciate that. And the first thing I wanted to ask you about is, how we're what we're seeing in terms of COVID activity and levels, not just here in Washington State, but across the country.
So it's always a pleasure to be with you, Ryan. What we are seeing right now, what we expected is a slight increase in hospitalization due to the rapid increase in infections. And as you know, right now, we're estimating at IHME that only about 6% of infections are detected. So we have much more infections than what is being reported. But fortunately for all of us, the variants that are circulating right now in the United States and in our state are subvariants of Omicron. And although they're competing among themselves, and we can talk about that, but they're less severe. And the fact that we've been infected by them, we have protection against them. And we're not seeing a huge increase in hospitalization, nor a huge increase in mortality, which is good for all of us.
So you mentioned we have some that are competing. The one that we're all kind of watching, I think, right now is XBB 1.5. But are there others that are trying to get a foothold as well?
So XBB 1.5 is the main one dominating right now. So the recent release from CDC from sequencing has it as the leading right now, and it has increased fast. It's now about 43% of what's circulating in the US, but we are still seeing a lot of BQ1, BQ 1.1, and the three of them account for the majority of infections right now. And the three of them, especially XBB, they remain less severe. Vaccines are highly effective against them. Previous infections are producing still immunity against them. The only difference what we are seeing is one of them, in this case XBB 1.5, is more infectious and being able to replace the rest.
So likely, and then to grow that percentage from 43 to probably really dominant then.
Exactly. It's the one that's moving to be dominant. And we have seen that across throughout the pandemic, especially with Omicron, that many of them come up, but another one is coming, and that new one is more infectious and it's taking over. So if you look at XBB 1.5, the previous release from CDC, we're talking about like 10 days before, it was about 27.6, and BQ 1.1 was the leading one at that time. Right now, when you look at the webpage of CDC, what CDC has recently released, XBB 1.5 is about 43% and is the main dominating one. So it's basically took BQ 1.1 out, BQ 1.1 knocked BQ 1 out, and many of them are coming up. But for our good luck, there is nothing good about COVID-19. All of the variants that are emerging right now, subvariant of Omicron, tend to be more infectious than the one before, but they're similar in terms of severity, similar in terms of immune escape. The vaccine is still effective, and also previous infections are still protecting.
Okay, because that was something else I wanted to ask you about. I had heard somewhere that XBB 1.5 might be more of an escape variant. So are we saying that it's not so much?
We don't see it yet. We don't. It has been increasing in the US, and we need to wait a couple of weeks to see the impact on hospitalization. But XBB, which is the parent of XBB 1.5, we've seen it in Singapore. So it hit Singapore, and we've seen a rapid rise in cases, reported cases. We know more so infections, but it didn't lead to a major increase in hospitalization. So we're still hopeful that XBB 1.5, although it's spreading so fast, is not going to lead to more hospitalization, but we need to be careful. We have to watch the data and see.
Of course. Now, you had mentioned a minute ago that that we're seeing other ones that are emerging and growing? Were you referring to XBB 1.5 when you said that's the one that's growing,
Yeah,
or are there
that's the
new
one.
ones?
That's the one that's really emerging fast. XBB 1.5, the first time we detected it, it was very small, sometimes toward the end of the year. Sometimes in the beginning of December is what was like maybe 2-3%. And suddenly it's like within a couple of months, it's becoming the main dominant one in the US. So it's spreading so fast. It knocked out BA5, it knocked out BF7, it's knocking out BQ1, BQ1.1. So it's moving so fast. But when you look at what's circulating in the US right now, although some of them are small fractions, we have a lot of variants circulating right now. I mean, we have BA1 to BA5, we have B11529. This one was homegrown here in California. BA2 12.1. I mean, we have so many of them circulating. Hard to keep up with the name BN1, BF7, but the main one right now is XBB 1.5.
Okay, and I want to back up. I know you touched on it in terms of vaccine effectiveness. Are we seeing that these vaccines are working, especially the new bivalent booster, because they're Omicron derivatives?
They are very effective. But you know, when people, you see some reports, Ryan, in the media right now, that among people who got the booster, they're still getting infected. Let's look at it from an epidemiology standpoint. The first one, these vaccines are designed to protect against hospitalization and mortality, not against infection. They do provide immunity against infection for a short time. But what's happening in the United States, people who receive these vaccines, including you and I, once we are vaccinated, we feel we are safer and we are more likely to get out and about, and we're more likely to get on a plane, we're more likely to travel, we're more likely to socialize. So we're more likely to be exposed to the virus than somebody who didn't get the vaccines, especially among the elderly population or the people who have some chronic conditions. So the vaccine for many people is providing me with a protection, which is true. And the fact that some of them are getting infected is not because the vaccine is not working, because those people, including you and I, once we got the vaccine, we were able to go out and travel.
Look, I admit I'm guilty of it. I have 5 shots in me now, counting the bivalent booster. And I've been a little more loosey-goosey. I still don't go out a lot, but like I went to my first movie in a
Yeah, yeah,
theater for
yeah. I haven't.
the first time, and the only thing that saved me was the movie was that Babylon with Brad Pitt, and it was so bad. My friend and I and just one other small group were in the theater, and they were way far away, so it was almost like we had the theater to ourselves, so it was safe. The lobby was more dangerous than being in that theater. And by the way,
I'm
friend,
also,
since we're talking about it, I'll throw that in there. Babylon is 3 hours and 9 minutes of flaming hot garbage. Save yourself the $15 and go see Avatar or something else, because it was a terrible, terrible. I don't do movie reviews very often, but we sat there for the whole thing and then sat there dumbfounded for 5 minutes as the credits rolled, because I was just so shocked. My first movie since the start of the pandemic, and that's what I ended up with. So I'm hesitant to go to the movies again.
I
But
haven't,
it's
I
the
haven't,
bigger point, of course, is that I felt safer being in there, and maybe I should have been more careful.
no, I haven't been to a movie in a very long time, but I've been traveling a lot, and I traveled to the Middle East. I traveled to Morocco. I traveled to Lebanon. I'm going tomorrow to New York City for my nephew's wedding, and I'm flying after that to Davos. So I'm traveling because I have 4 shots in me, and I also got COVID after the 4 shots. So I have some immunity right now, and I'm less careful, I have to admit, but I still wear a mask on the plane.
I think that's a wise idea. So I also want to back you up, because we talked about sort of nationally what we're seeing. What are we seeing? What are your colleagues at UW Medicine saying to you about what we're seeing in terms of COVID activity here in Washington State?
We're seeing an increase in cases, but not what we were afraid of. We prepared for, that's what we do here at UW, we prepare. but we didn't see it. We've seen a lot of flu, RSV, uh, and it's coming down right now. But before, towards the end of the year, we were a little bit overwhelmed, especially our children hospital with RSV and flu. But we are in much better position right now. Keep in mind that the Seattle community is more vaccinated than other places. And I want people who are listening that our experience in Seattle, because we have more people vaccinated, we have more people who are more likely to wear a mask than everywhere else. We're in a much better position and we have good quality medical care here. But for everybody else, especially right now in winter, we need to be very careful because this virus is seasonal. Flu is seasonal, RSV is seasonal, and for many people, because we took all the measures to protect ourselves in the past 2, 3 years, many of our children have never seen flu, many of our children have never seen RSV, and we need to be still remain careful.
And so you mentioned that flu and RSV are coming down. How sharply are we starting to drop off? Is it a pretty good, or is it kind of a slow decline?
No, it's right now. It was a slow early on. Right now, it's pretty good coming down, and that's my concern, Ryan. That many people will look at the data and the numbers and feel they are doing much better. Remember, in Seattle, in Washington State, the flu season usually is delayed. This year we had flu much earlier. It peaked much faster. A pattern that we have seen, by the way, in Australia, we have seen the same pattern in London, where we had more cases early on. It peaked so fast and came down. However, in both countries, yet to be seen in the US and in Washington and in Seattle, in both countries, what we look at is under the curve, the number of flu and RSV in total was less than previous year. Yet to be seen here in the US. And I hope people here remain vigilant, especially around children, in order to protect ourselves. Let this winter pass, and hopefully after this winter, looking at the data when it comes to COVID and when it comes to other global health threats, we are in a much better position except for climate change.
Absolutely. And I'll make another good point too, because we know sometimes the flu shot can be hit or miss when we're gauging it based on what was in the Southern Hemisphere 6 months ago. Sometimes we're shooting ourselves with last year's strain. But your colleague, Dr. Helen Chu, pointed out, and I was very glad to hear it, that this year's flu shot is a pretty good match for what's going around. So it's never too late to get it. If you haven't gotten it, worth getting it. So
exactly, get the flu shots. I did, and I haven't got any flu, and I've been around people who got flu. So it is working, and I'm happy it's working because we really need all the help to protect our hospitals.
well, and I did the same thing again, where I got the flu shot and the bivalent COVID booster at the same time, and then spent 3 days, 1 minute hot as the oven, and the next minute shivering under my blanket. So as I do that, sitting there telling myself, it's all worth it. It's all worth it. I'm going to be protected, as my teeth are chattering. But I do personally feel that it is definitely worth it. Now let's talk about China, because IHME had predicted this. Your colleague, Dr. Chris Murray, I've seen him speak about it more than once, that the zero COVID policy was not going to be sustainable. And as soon as they started loosening things up, COVID would go hog wild in China. That's what we're seeing, isn't it?
Exactly. That's what we're seeing. A lot of infections in China. Need to keep in mind that we have little information coming out of China. Unfortunately, we don't know what variants are spreading there. We don't know how many infections a day. We don't know how many mortalities. We don't know hospitalization. But it's expected. Why? Let me briefly tell you why. Because of the zero COVID policy in China, many Chinese were not exposed to the virus. Remember, 98% of people in the US have been infected at least once with COVID-19. Add to it, in China, the vaccination campaign happened much earlier. They did a good job giving 2 shots. They have a high vaccination rate. However, they have a very low vaccination rate among their elderly population. Many people in China, about 75 or 80, refuse to get the vaccine due to belief in traditional medicine. You put all of these together, Chinese in the United States, about 75% of us have some immunity against Omicron. In China, it was about 25%. So you have 75% of the population susceptible. You have variants right now. We've been talking about the variants in the US, XBB, that was circulating in Singapore. So you have all these variants that are really super spreader, and you have a population that is really has no immunity whatsoever. You're seeing this rapid increase in cases. What's helping China to some extent is the fact that these variants that are circulating right now are less severe. So if they had Delta, it would have been really bad. But at the same time, the sheer number of infections and the sheer number of hospitalization will overwhelm their medical system. And that's what we are seeing right now in China.
So they're seeing full hospitals then, is what you're saying?
In many places, there are reports that their hospitalization is under pressure, especially elderly population. And when the Chinese, by the way, reversed the zero policy, they had a document of 10 points. It was in Chinese, and some of my friends translated it for us here at IHME. And in one of their points, they were like, we were going to increase boosting the elderly population, reach out to them, which is very good, and they worked at that. However, the opening was so fast. They should have done the vaccination before they opened, but they opened and came to the public and said, you want to go out, you want to celebrate the new year, by the way, the 22nd. You need to get the vaccine. So they're catching up with the vaccine. And the other point they had in there is we will reserve some hospitals for the elderly to make sure we take care of them in order not to scare the elderly population from coming to the hospital. So these measures, we don't know how effective they are because we don't have data. But at least the initial plan, when they were moving away from zero COVID, they had a very decent plan to move forward.
Well, and when you say they're rolling out the vaccine, they're not rolling out Pfizer or Moderna. They're rolling out the Chinese vaccine, and we don't know how effective that is.
We know it's much lower effectiveness than what we have here. We know that. We know they have refused donations for mRNA vaccine. We know they have licensed mRNA vaccine. So they allowed, and my guess would be foreigners who want, like embassies who want to import vaccine for their staff and their citizen, they allowed that to happen. But yes, their vaccine is less effective. However, it's still effective if you give it after 2 weeks. It's very effective against hospitalization, much more effective against hospitalization and deaths. Again, still lower than mRNA, but it provides certain immunity, and which is very important. The best vaccine, we keep repeating that, for you is the one that's available for you. You go and get it as soon as possible.
Absolutely. So whenever we talk, you always tell me, you always answer the question that I haven't asked. What did I not ask this time?
There is and I want to make that point. There is a concern right now, and there is a policy. You need to be tested if you're coming from China for COVID-19. I don't think that policy, quite honestly, is effective. It has never protected us. Remember, last time when COVID-19 arrived to New York, it came from Italy. It did not come from China. We said no travel is allowed from China. We allowed everybody else to arrive. And then we suddenly had it from Italy. So that policy, in my opinion, is not going to protect us, may delay, the arriving of one of the subvariant. But what's circulating in China right now, to our knowledge, we are not aware of any subvariant that's different than what we have. So we should not be afraid. The last point, many people are afraid because in China, 1.4 billion, if you say 75% are susceptible, the sheer number of infections, many people are concerned that it will produce another immune escape variant that will make the vaccines less effective or previous infections less effective. I don't believe that it is possible, but I don't believe that would be a major concern, simply because Omicron and its subvariants spread across the whole world. We had 3 or 4 billion infections, and we didn't see a variant that's immune escape in a sense of making the vaccines less effective or making previous infections less effective. So don't expect it, but something you need to keep an eye on. but we shouldn't be concerned about what's happening in China. The last point, Ryan, which is very important. Remember, you and I talked when Delta was spreading in India, and India was dealing with a rapid increase of infections at that time and a heavy load of mortality because Delta was more fatal than what we have right now. Everybody in the world rushed to help India, which we should have done, and I supported that, and you and I support that. The same should apply to China. We need to help China because I'm not safe, you are not safe, my family is not safe here in the US until everybody on this planet is safe. And we need to help China rather than putting some restrictions on China. It's time to open up rather to go back.
Not always easy to do when we're trying to donate mRNA vaccines and they're refusing the donations, but certainly, definitely
Oh, no,
worth a
definitely.
shot.
No, definitely not easy. Remember, politics and science. I'm a scientist, I'm a population health person. My message is always try and keep trying, and hopefully somebody will change their mind and accept your extended arm.
We can always hope. All right, IHME's Dr. Ali Mokdad. Appreciate that, doctor.
Take care and all the best.